Aloha, I'm Dr. Sean Delaney with Kalani Total Health Center. Today, we're going to continue talking about knees, chiropractic, and just maybe some things you don't know about your knee. The knee itself is made up roughly or made up of four main bones. Also, it has multiple muscles that support that joint. It has multiple ligaments that hold the joint together, as well as a little cartilage called the meniscus that acts like a shock absorber between the bones of that joint. It is considered what we call a hinge joint. That means it just primarily works like the door hinge on your door. It just opens and closes. It's designed to move primarily in one direction. That being said, the knee is also a weight-bearing joint. It's the second most weight-bearing joint, maybe potentially in the body. Maybe the hip is more. Remember, you might know the hip takes stress at about 6 times the amount of your body weight, whereas the knee joint, for every 1 pound of body weight, it's 4 times the amount of pressure applied to the knee. So being one of the most stressed joints, one of the most complex joints in the body, maybe next to the shoulder, with as many muscles and attachments and ligaments and things like that. That's what makes it so complex. That also does what? Makes it one of the most injured areas of the body, or the most vulnerable to injury. So with that being said, so what does the knee really rely on? The knee relies on a lot of balance between the ankle joint below it and the hip joint above it, and all the muscles that attach to those. So all these things must work in unison, and they must be balanced out, because if you end up with some type of ankle injury or some type of hip injury, you end up taking those forces, or lack of movements now becomes a problem with the knee. So now you're asking the knee to do more than that open close movement of the hinge joint. It has to now, deal with rotation and glide from the femur joint or from the tibia below it, which is also going to increase the stress and increase the risk of injury at the knee. And, that's a problem, but that's just something we all have to deal with. And then bigger thing is, who knows the true reason for why you're having pain? That's why it's important to have that diagnosed or go get it evaluated by somebody, so we can figure out, where is the pain coming from? And this is another reason, with so many muscles, there's like about 12 muscles that attach around the knee joint, as well as the muscles of the hip, as well as the muscles that work your ankle joint. Exercise is so important. If you can strengthen the exercises, with exercise, and you strengthen those areas of the hip, the muscles surrounding the knee, as well as the ankle, that really decreases the risk of injury to the knee joint, because you have more muscular structures around it that are stronger to help absorb the different forces or stresses that come into the knee. That stuff is vital. And this is where we come in here at Kalani Total Health Center. You come in, we take you through our process of evaluation. We set up a treatment plan, but through our evaluation processes, we're going to help you discover, where's this pain coming from? Is it a true knee problem? Is it coming from my hip, my low back complex? Is it coming from my ankle? Or are the muscles imbalanced? And then, once we can figure out what's truly causing your pain, then we put the treatment plan and start putting action into getting you out of pain and rebalancing the body and getting these joints to work properly, which therefore is going to decrease the stress, make the stress, equally distributed among all the joints involved in movement, and therefore decrease your pain. And now you're a happy camper again. Give us a call, schedule an appointment, come on down. Let us help you get to the root cause of why you're having knee pain. Once again, I'm Dr. Sean Delaney with Kalani Total Health Center, your one-stop holistic health shop. Mahalo.